Doctors in northern Italy on the front line of the virus outbreak. In just a few weeks, the normally well-resourced health service here has been overloaded, with huge demand for intensive care. Ventilators are one of the key pieces of equipment critical care doctors use. They blow air into the lungs, keeping patients alive. The government has called on manufacturers to step up production of them for the NHS, but intensive care doctors say that could be easier said than done.
We're asking companies here to produce ventilators in double quick time, and that will require a lot of work by the regulatory agency, the MHRA, and they would have to work with the anaesthetic community and the intensive care community to make sure that what is produced is to the specification we need. Above all, they've got to be reliable, fail-safe and intuitive.
As the outbreak spreads, routine operations may also be postponed, freeing up further equipment.
We've been raising for some time now the point about ventilators, and we need to buy up those ventilators. We should have been doing that weeks ago. But of course, ventilators need staff to operate them, so we need to understand how staffing will be changing in the NHS.
Where patients are treated could change as well, under government plans to buy up private beds to boost capacity.
Spire Healthcare, which is headquartered here in London but runs almost 40 private hospitals across the country, has already been asked to help. But while the government says the NHS will get whatever funding it needs, others worry about the number of beds the health service currently has to care for those with the greatest needs.
NHS England has around 7 critical care beds for every 100,000 people. By comparison, in the European centre of the outbreak, Italy, that figure is 12, while in Germany it's 29. That disparity is partly because of differences in admission criteria to intensive care units in the UK. But doctors say tight budgets haven't helped.
It's a result of a decade of underfunding, and now what, therefore, we need to do is make some really decisive decisions on how that limited resource is used in the best possible way.
The government is now putting more money into the NHS, with an extra £5 billion announced last week just to tackle the virus. But with COVID-19 cases increasing by the day, time and trained staff may be the two commodities the health service needs the most. Rob Powell, Sky News in central London.